Serious doctors of Reddit, what is the most disgusting thing you've seen on a patient's body?
A guy was street racing with his 2-year-old daughter in the back of his car. He rolled the car. Little girl was fine. He, on the other hand, had his arm ripped off. When limbs come off, they're usually severed pretty cleanly in an accident or crushed and need to be amputated. No one in the edit had ever seen one ripped off. It was pretty brutal. Edit, arm was not reattached.
Some of you may know Smegma, otherwise known as Dick Cheese, was an intern at the time, working at Casualty Emergency Department. In came a male, IDK if he was homeless or not. He was aged around 50 to 70, can't remember. He couldn't pass urine on his own, so catheter it was. But first the lil man down there had to be cleaned. Here's where the smegma came in. It was thick. Some of you may have it like in clusters. A little bit here and there. This guy had it like it was a scarf covering his thing. And the scarf was thick as a rope. You know that typical image of a girl in snowy environment, wearing snow cap and thick scarf encircling her neck? Just imagine that and correlate it with my story. I still remember it because that was my first catheter insertion. I threw my back out because cleaning it took a long time. I think he should have some abrasion with the way I cleaned his lil man. Circumcised or not, clean your thing, guys.
In medical school and was doing my rotation in the emergency department. I come in for my shift and the resident sent me into a patient's room to change their wound dressing. Easy enough. So I go in there and I see this dressing is absolutely filthy and smelled terrible. Apparently it had been on her burn wound for over 2 months because she was afraid to touch it. I carefully use saline and start unwrapping the bandage, which caused extreme pain. As I got a couple layers down, I start seeing things move and I thought it was me starting to get lightheaded from the smell, but I looked closer, it was thousands of maggots. Finally got to the skin, cleaned off all the maggots I could see, then returned 30 minutes later to see it covered in maggots again, meaning they had burrowed under the skin.
In medical school now, and I had a patient with a hole in their back the size of both of my fists together due to a stage 4 pressure ulcer. I would have been able to touch their spine while we were cleaning the wound if I had been so inclined. We took a massive chunk of necrotic tissue off of this guy, and the fellow I was working with said he would most likely die with the wound because it had gone so far. But nothing I can do can describe the smell. Even through an N95 mask and a surgical mask I was wearing, it was so overpowering that I still have nightmares about it to this day.
In med school I met a gentleman who the world had let down, homeless, disheveled, malodorous, and he wasn't quite there upstairs due to chronic alcohol use. Sweet guy but very confused. He said he came into the ed because his foot hurt. Covered in random scratches and bruises which didn't bother him. We suspected he had significantly reduced sensation from neuropathy. There are different types, e.g. alcoholic neuropathy, diabetic neuropathy. We put on some gloves. I extend his leg while the senior registrar removes his boot, and a chunk of his foot came off with it. Just a big chunk of heel. His foot was covered in necrotic tissue and the smell made my stomach turn. The old boot had been acting like a compression stocking, holding his foot together until it didn't.
Saw a kid with a softball-sized facial tumor that was basically rotting. The gross part was the hordes of maggots devouring this poor kid's tumor. It was incurable, but every few weeks he would come in for the surgeons to debulk the tumor so that it didn't get too big. When the electrocautery pen hits a maggot, the maggot vaporizes.
I was a medical student for 2 years, ultimately dropped out, but I had an obese patient that had maggots in between her fat rolls.
Limbs displaced is the hardest for me. Saw a motorcycle rider who clipped a parked car with his foot and came in with his foot on backwards.
I am an ENT resident. I saw a gentleman with a history of cancer on his scalp. The ed called because they thought his scalp was infected. Walking in the room, it immediately smelled wretched. When I looked at his head, I did a double take because I saw a patch of his scalp literally move. When I examined closer, I realized that it was a swarm of maggots crawling around his open wound, which was exposed skull. Maybe the maggots actually helped control the infection, IDK, but I felt very sad for him.
Couple for me, couple for my friends. Old lady, like 80, got hit by a car at low speed. Had a penetrating tib fib that tore through the calf muscle, broken hip, and a bunch of other abrasions. In people that age, the mortality rate skyrockets to like 90% inside 12 months when there is a hip fracture, so her quality of life was significantly reduced as a result of that. A heroin addict punctured his eyeball when trying to inject into the corner of his eye. My friend was an intern at that point, and apparently it was his spirit killer patient. An older European man tried sounding with a straw from a WD-40 can and tore his urethra on the sharp edge. He was pretty chilled out about it, but his wife wasn't. If you're gonna do some sounding, use a proper instrument with a rounded off tip. And for slam dunk grossness. A young man had visited a sauna, which is Commonwealth slang for a bathhouse where gay men go to have promiscuous sex. This guy had unprotected sex with multiple partners and then freaked out he might have got HIV. So he came into the ed and wanted to get tested. No biggie, right? Well, he was in tears and fearful and had a language barrier, and so couldn't understand why we didn't need to test the ice cream container full of beep and cum that he'd fished out of his ass after his sex tirade, and instead could just do a blood draw. Suffice to say, there is no biohazard bag thick enough to dispose of that, and chocolate ice cream was off the shopping list for a few months too.
I have to say, as a nurse, the necrotic toe the surgeons elected to not amputate but kept saying if it comes off during a dressing don't stress was pretty beep. You know that thing you can do when you bend a finger at the second knuckle and you can wobble the tip? That, but 2 toes.
When I worked as a vet assistant, a family boarded their dying golden retriever with us. Dog had multiple tumors, each sitting on the skin maybe 1 centimeter thick and 5 to 10 centimeters diameter, many of which were necrotic and weeping. Whole dog wards smelled like roadkill. Very distressing. Doctors had tried to have the euthanasia talk with the owners several times, but they just loved their dog too much to say goodbye.
Not a doc, but a former ER nurse. I once had a guy that was brought in after lying on the same side on his apartment floor for about a week. The neighbors called 911 because of the smell. Everything had rotted away to the bone on his hip, and when he moved his legs you could see the joint and ligaments articulate. He was also covered head to toe in scabies. Edited to add, his overall look I would best describe as the guy who was Sloth from the film Say 7N.
One guy walked home from a party and ran over train tracks because it was shorter. He got hit by a train and his left arm got ripped off. Not just clean cut, but ripped. To the part where you could exactly see where the vein was snapped. The worst thing was that, because he was drunk, climbed back up to get his phone and got hit by another train. That train just ripped both his legs off. We got him, still alive because of the heat and pressure of the train. Your wounds are sealed and he didn't bleed to death, but damn that sight. 1 leg ripped off above the knee and 1 under the knee. He was awake and cooperative and wanted to help move his legs, which he still thought he had. But it was just pieces of meat dangling. The guy actually survived, after a hard battle. Of course without legs and that left arm, but he is an example for everybody. Plays tennis, ping pong, actually graduated.
Anesthetist here. We were inserting an urinary catheter into an elderly woman. It smelled so foul, like some poor fish had died and been left baking in the sun for day. As the catheter went in, streams of brown pus started leaking out running along the catheter. Turned out to be a really bad UTI. Also necrotizing fasciitis, don't Google it.
20 beep-covered reusable tampons, in someone's rectum. Lady didn't realize they had been going in the wrong hole all this time and thought they would dissolve. After the persistent diarrhea and abdominal pain, she decided to come into us. And we went fishing. I'll never forget that adventure.
Saw a guy with a fungating rectal tumor. It looked like the clickers in The Last of Us.
May your day be filled with joy and happiness. And please remember to like, share, and subscribe for more quality content every day.